Hemorrhoid embolization. Frequently asked questions. Answers from Dr. Bilal Anwer at the Leg Pain Clinic. What is hemorrhoid embolization? Hemorrhoid embolization, also called hemorrhoid artery embolization, HAE, is a non-surgical, image-guided procedure that reduces blood flow to swollen hemorrhoids, causing them to shrink and relieving symptoms like bleeding, pressure, and discomfort. It is performed through a tiny catheter inserted into the wrist or groin, with no incisions or stitches. How does it work? Using live X-ray, fluoroscopy, Dr. Anwer threads a small catheter to the superior rectal arteries, which supply blood to the hemorrhoids. Tiny embolic particles are injected to block blood flow to the abnormal vessels. As a result, the hemorrhoids shrink, inflammation resolves, and symptoms improve without surgery. Who is a candidate for hemorrhoid embolization? You may be a good candidate if you have bleeding internal hemorrhoids, hemorrhoids that have not responded to diet, medications, or office procedures, recurrent hemorrhoids, a desire to avoid surgery, or are not a good surgical candidate. Dr. Anwer will assess your symptoms and imaging to determine if HAE is right for you. Is it painful? Most patients report minimal discomfort. The procedure is done with light sedation and local anesthesia, and there are no cuts or stitches. Mild cramping or pelvic pressure may occur after the procedure and is usually controlled with over-the-counter pain relievers. How long does it take? The procedure typically takes 30 to 60 minutes and is done on an outpatient basis. You'll go home the same day with simple post-procedure instructions. What is the recovery like? Most patients return to normal activities within 1 to 3 days. There are no restrictions on bowel movements, no open wounds, no sutures, and no downtime from work or travel. How effective is hemorrhoid embolization? Studies show that 70 to 90% of patients experience long-term relief from bleeding, pain, and swelling. It's a safe and effective alternative to surgery, especially for internal hemorrhoids that continue to bleed despite conservative care. Is it covered by insurance? In many cases, yes. Hemorrhoid embolization is typically covered when performed for medically necessary reasons such as rectal bleeding, failed prior treatments, or chronic symptoms. Our team at the Leg Pain Clinic will verify and assist with pre-authorization. How is it different from traditional hemorrhoid surgery? Unlike hemorrhoidectomy or stapling surgery, HAE involves no cutting, no sutures, and no anesthesia risks. It avoids damage to the anal canal, reducing the risk of pain, incontinence, or complications. It's especially valuable for patients looking for a non-surgical option with fast recovery. Why choose Dr. Bilal Anwer at the Leg Pain Clinic? Dr. Bilal Anwer is a board-certified interventional radiologist with extensive experience in minimally invasive vascular procedures, including hemorrhoid embolization. He is one of the few specialists in the Houston area offering this advanced treatment. At the Leg Pain Clinic, you'll receive expert personalized care using cutting-edge imaging and techniques, all performed safely in an outpatient setting.